Hello, my name is Graham Elwood. You're watching The Political Vigilante. This article was submitted by Patreon supporter Jazmin Man. Thank you so much for supporting the show. And it's a great way to help the show out is go to patreon.com/Graham Elwood. You can support the show for as little as $1 a month. Other great ways to support the show that are free. Don't skip the ads on YouTube. When you press skip ad, I don't get paid. So let them play all the way through, even if they're ridiculous and stupid. That helps support the show. Like, subscribe, even if you've done it numerous times. Hit the bell notification button, and then follow me on social media and download the podcast on iTunes. All those things help the show, the analytics of it. So this is the email that was sent to me by Jazmin, and there's a bunch of articles to support this information, and it's pretty alarming. There are estimates that half of children being born in the United States have or will develop a chronic disease. This has a huge implications for Medicare for All and the economy at large. This is staggering. This is staggering information. Again, I'll put the links in all the show notes below. More than 54% of American children are suffering from one or more chronic illness, with the late 80s and early 90s viewed as the gateway period that launched the decline. This is from childrenshealthdefense.org. That's a staggering amount. And the article asks the question, what is causing all this? In just about all of these articles, the question is asked, is it the environment? We have to ask that question. Is it the environment? Because this doesn't seem right. What is causing this? It makes sense. We're pumping all this crap into the environment. Monsanto and companies like that have all this horrible food. What are we doing? High autism rates, all this stuff. There's something's up. Something's up. And a bunch of different sources are all saying the same thing. Like, this was from the CDC. The Center for Disease Control. 6 in 10 Americans live with at least one chronic disease like heart disease, cancer, stroke, or diabetes. These and other chronic diseases are the leading causes of death and disability in America, and they are also the leading driver of health care costs. We need Medicare for all. Look at this. 6 in 10, that's 60% of the country. Is it a coincidence that 60% of the country doesn't have $1,000 in savings? Yeah, because they're spending it on all this stuff. Because their health care is through the roof. Imagine what this country would look like if we had Medicare for all. Part of the thing that happens when you have in societies that have free health care, there's a lot of preventative medicine. I remember when Obamacare passed, they started doing some research and articles, and there were people that like, I'd never been to the doctor. So they only went when things got horrible, and then the costs were even more. Like they only went when there was an emergency, so the ER costs are through the roof. Or after something's been exacerbated, they do preventative care. It's like, oh, I didn't know. And because our education system has been so gutted in this country, they don't even have good access to information on how to live a healthy life. No matter how healthy you live, guess what? Your body's going to break down at some point. For some reason, you're going to get injured, sick, something. I'm very healthy. I just was sick. I had a sinus infection. I had to go to urgent care on a Sunday because it was so bad, and I had to get antibiotics, which I don't like. I rarely take. I rarely take prescription drugs, but my natural hippie ways of zinc and vitamin C and echinacea, all that crap wasn't working. We had a whole country. I mean, what would the quality of life in this country be like? And it's funny, they're always talking about, oh, what's it going to cost? What's it going to cost? You know how much we're spending now? You know how much money we would save? This is the recklessness and the greed of the corporate media, because the healthcare and the big pharmaceutical companies buy a lot of ad time. They say stuff like, oh, Medicare for all would cost $35 trillion. Well, they don't talk right now we're spending $38 trillion, whatever, you know what I mean, or 30 billion, whatever. But they didn't say that. They just happened to leave that. They conveniently left that number out. And it's like Bernie Sanders said for $60 billion a year we could have Medicare for all. $80 billion was the amount of money that Elizabeth Warren and Tim Kaine and 3 other Democrats gave to Trump in October of 2017 in the form of a bigger military budget that he didn't ask for. This is for real, man. This is from the CDC. This isn't from some hippie site. Here's another. The National Cancer Institute says there has been a significant increase in the overall rate of childhood cancers in recent decades. Up 27% since 1975 in kids under the age of 19, according to the data collected by the NCI's Surveillance, Epidemiology and End Result Program, SEER. When you see an increase like that fast in a short period of time, most likely it is going to be driven by some exposure to environmental factors. Ba-boom, ba-boom. Says Catherine Mateer, MD, PhD, and adjunct professor at the UC Berkeley School of Public Health. She and her team just won a $6 million grant from the National Institute of Environmental Health Sciences to study the causes of leukemia in children. I don't care if you're a hardcore Republican. This affects you and your children. Don't you want to know? And the Democratic Party, man, they'll give lip service to this shit. I mean, I'm glad they're giving $6 million. That's federal grant money. Do you see what I'm saying? Why, you know, we need to spend money on important things. When Brian Williams was jacking off over watching a rocket, I wonder how many cancer studies we could have spent money on for that instead of rockets. We drop 100 bombs a day on average, the United States, and all of our wars all over the world. 100 bombs a day. But who cares if there's a high rate of leukemia in kids? Don't worry about it. Chronic diseases are the leading cause of death and disability in the United States. 133 million Americans, 45% of the population, have at least one chronic disease. Chronic diseases are responsible for 7 out of every 10 deaths in the U.S., killing more than 1.7 Americans every year. How expensive is this, too? Not to mention how horrible it is on the people and their families. They're always talking about costs of tax breaks. Healthcare premiums for employer-sponsored family coverage have increased 87%. See, when I talk about how the Green New Deal and MMT can fix so many problems, if we went to a Green New Deal, part of a Green New Deal would be like, anything that's bad for the environment, we're not doing it anymore. Pesticides, it's done. It's done. I bet you these rates would stop dropping, right? See how that's connected? We give free college tuition to everybody, right? And we're all behind everyone's working for the Green New Deal. And just like the war effort in World War II, everyone was involved in one capacity or another. Even if it just meant a victory garden or saving your tin cans, everyone would be involved. Part of what would be happening on university campuses with all this free college tuition would be research into finding cures and causes and stuff like this. If our whole sole purpose was to save the environment, then anything we were doing that was bad for the environment would be like, that's got to go. We've got to find a better solution. See what it could do? Increased by 87%. Healthcare coverage costs for people with chronic conditions average $6,000 a year annually, 5 times higher than for those without such conditions. The total cost of obesity to U.S. companies is an estimated $13 billion annually. Again, part of a Green New Deal would be organic food, fresh food. Not fucking Monsanto bullshit, because that's not good for the environment. Having an obesity epidemic in a country is not good for the economy. It's not good for the environment. Let alone it's not good for the overall health of this country. Truthdig just did an article about the high suicide rate. If everyone's suffering from chronic illness and obesity and there's no money to pay for it and they're paying 5 times a year, gee, I wonder if that contributes to depression, which can lead to suicide. There's a lot of factors with suicide, obviously, but that's one big one. $13 billion annually. This includes the extra cost of health insurance, $8 billion, sick leave, $2.4 billion, life insurance, $1.8 billion, and disability insurance, $1 billion, associated just with obesity. We total all this up from all the other chronic illnesses they're talking about. Thank you, Jazmin Man, for submitting this article. Folks, support the show at patreon.com. And if there's any tiers that I'm not doing or things you want me to do with Patreon, let me know. I'll do something cool, whatever you want me to do. I can do a special, whether year-end special or something. I don't know. But thank you for supporting the show. Share these videos, like and subscribe, and go to GrahamElwood.com for all my tour dates. Thank you.